This is Jody Tropiano, the Content Director for Health, and I'm here with Dr. Jay Bhatt, who is a primary care internist in Chicago and former AHA Chief Medical Officer. Hi, Jay.
Hi, Jody. Great to be on with you.
Great to chat with you. So we're just going to go over a couple questions related to the COVID-19 pandemic and get Dr. Bhatt's opinion. So first question is really just what the biggest misconceptions out there are right now concerning the pandemic. What do you think needs to be cleared up?
Sure, Jody. And before I get into that question, I just want to say thank you to all the care teams, frontline caregivers, and all of those working to help us get through this pandemic. And it's just been inspiring to see the work happening by all kinds of people in different sectors, not just health. But I know that my colleagues are in the front lines trying to take care of patients, and we need to continue to support them, as I know communities around the country have. And I would say the misconception, one of them is that it takes a lot of different, let me try that again. One misconception is that exposure to this virus may only engage certain populations, but we're seeing that this is impacting populations, young and old, with health conditions, without. And it's really this issue of we don't know a lot about this virus. And so it's presenting in ways that aren't always apparent, or might set off alarm signals for people to say, oh, I might be exposed. I should take the next steps to figure out what to do. So I'd say that's one. Two is there's a lot of misconceptions about what the testing allows for folks to do in terms of their action forward, the treatments they need, whether they can stay quarantined or need quarantine. Again, I think it's very important for us to focus on staying at home and being individuals that don't expose the public. I think because this is one where anything we do affects other people, outside of our homes and within our homes, certainly, and with our families. So I think that there's still conversations about what are the right tests and when do you use them for different individuals, from the long term testing to short-term testing to antibody testing. And so that's the other area. And I think those are some of the big issues. The final one I would say is related to when we might hit peaks of cases and when things might start declining in terms of the number of cases. And so there's a number of different models out there that are suggesting progression of the pandemic, and it's some of that data is modeled on death data from China and Italy, and it's not necessarily modeled on case data. And so I think we have to be just very careful by just looking at one model. The Chime model is one that seems to be getting some traction.
That's great. That's good information. And so as far as the federal government, they've made a lot of steps, whether we agree with them or not, up to this point, but where do you think they've succeeded and where have they maybe not made the best decision so far?
I think it's been wonderful to see the kinds of action that's being taken, certainly by CMS and other agencies, to make it easier for care to be delivered, both remotely, virtually, in hospitals, in health systems. I think the support in various ways of the care teams that are happening across agencies, and the rapid action of the FDA has been, I think, some of the bright spots. And I think Dr. Fauci has really been a helpful voice, along with members of the coronavirus task force, and helping us work through the information, understand it, make sense of it, and take particular actions. I think the federal government has been late to this response. I think that there were signs early on, as we've learned from H1N1, Ebola, and other public health emergencies, that we've got to act decisively and act quickly. And so I think the stay-at-home orders could have been done earlier and could have been done nationally. I know there was some reluctance of letting governors decide. And I think that may have been okay early on, but then shortly thereafter could have gone into a national effort around stay at home. I think the work that's been done around the stimulus and supporting various sectors, I think is a good start, but it's not enough. I think people are going to need a lot of help moving forward. And so I think that's another area. The other area is around testing. I think you potentially could have developed tests early on. And I think that's the best sense of to understand what's happening in communities is to be able to have testing. And then the treatments, we could have also been ahead of the game on treatment, vaccine and both treatment when folks are exposed. So those are some places where the federal government could have played an important role. Now, again, I think that they're bringing together the resources of the federal government, the agencies, to do the work that's needed. But the area that I find really hard to understand is the stockpile and the federal resources that can be marshaled around the Defense Production Act and all the various supplies that are needed. I think the Army Corps of Engineers have done a great job in standing up various facilities, but our clinicians, our care teams need protective equipment and need ventilators and need the various supplies. And there clearly was a way to act decisively to get that to the front lines earlier, rather than the way that it's playing out now.
Yeah. And you mentioned governors. So as far as the state governors have gone and the state governments, where do you think they've been successful in preparing their communities for this?
So I think we've got, examples certainly in New York with Governor Cuomo, here in Illinois with Governor Pritzker, where, and you see it across the country in different ways, Governor Newsom, the way that they're going about informing and briefing the public with the focus of supporting the public and saving lives is paramount. I think that that's been really helpful. I think it's the work that they're doing to reinforce this stay-at-home policy and marshaling their state resources around the needs that the public may have. Also, there's some states doing this work around reallocation of resources, so that to getting resources from areas that might not need it right now to areas that are in dire need of whether it's protective equipment or ventilators or workforce. So I think that that's important. And continuing to be driven by data and science, which I think is important rather than assumptions that might not be true. And the models and are only as good as the assumptions. So it's also important to be able to have dialogue and conversation about, given the information we have, what are the best decisions made.
Yeah.
So I think that those are some of the things that they're doing well. Some of the things that I've seen that could be better is, again, where there's not consistency in message. You see different messages coming across at different times, and sudden change, it seems like, in where things may be heading. I think the approach of trying to be resource as opposed to also saying this is what you have to do as the public. I think when the public sees the government, and particularly governors, as a partner and a resource to them to help them live their lives in the safest way possible, then that really resonates, and doing it with sort of strength and compassion. Yep. And so I think, again, this piece around, we saw Florida's governor not act quickly on stay at home, and we saw a significant exposure potential there. We've seen similar situations. It's interesting when you look at the map around Medicaid expansion and overlay it with even last week, states that had not done stay at home orders, there's a very much a similarity there, which is interesting. So I think when you overlay some of this data, again, people then are more at risk. So the places where there isn't Medicaid expansion means people don't have access or coverage, yet they're at significant risk of being vulnerable and sick if they if the public doesn't take action of staying at home, really driven by the governor. So that's, I think I found that interesting. I think there are situations where they're not necessarily taking in the best information from their teams, particularly from the public health experts and the clinicians on the team. And so I think that that's important. But I think really encouraging to see some of the wonderful actions being taken, and hope that that spreads around the country.
Yeah, hope so too. And switching gears, talking about the hospitals in particular, do you think that they have the PPE and other equipment that they need right now? Or if they don't, do you think they're able to get it in time before the apexes hit in the various states?
Yeah, I think that we don't have access to the amount of PPE we need. Again, if you think about it collectively as a country, we're going to need more than we have currently stockpiled, and certainly in places, in particular cities and states. There's some places that are not being hit as hard, and so there's opportunity, I think, to be able to use that equipment based on the data and share it with those places that might need it most. So this is, I think, a reallocation opportunity as well. But I think we got to continue to get supply in from wherever possible and manufacture PPE, at significant rates. Now we've seen ramp up on ventilator production in pretty significant ways, and so I think that with PPEs, is there not a way to do the same? And we recently launched at the American Hospital Association, when I was there, the 100 Million Mask Challenge, which was trying to get manufacturers to upskill and act differently. There's also getmyppe.org, and there's several other places that are trying to bring together communities of actions and stakeholders to get PPE to places that need it.
Yeah, interesting. And I saw, Cuomo was calling on private companies to come forward and help develop some PPE. So it's been interesting, all of the efforts going on. And
facilitating the private sector has been great. I think the private sector has really stepped up in a lot of different ways to support fighting the pandemic.
Yeah. And just working with the hospitals in your former role at AHA, what stories are you hearing from the front lines? Do the clinicians that you talk to, do they have enough PPE? Are they feeling confident and comfortable?
Yeah, so I think that there are places where folks feel like they have what they need, and then there are a lot of places where they don't. And that's part of the challenge of this, is that, this virus doesn't discriminate where it hits or where it goes or where it attacks. And so we need to be ready, and particularly those places that are hit hard now and going to be hit hard in the future. And we know that this isn't just the wave in this current moment. I think that there are going to be a number of different waves moving forward. There's some really inspiring stories from the front line, I think, from the way that caregivers are taking care of patients and being there as their family when their family can't be, to help them through this challenge, because families can't come to the hospital. I think you're ending up in situations where folks are getting extubated. There's kind of a Brush has a prone position team, for example, where they are solely responsible for making the changes in the critical care unit to help increase survival and support restoring the path to having people come off the ventilator. There are COVID units versus non-COVID units, so you're trying to isolate and separate potential exposure. There are ways that folks are honoring people as they make progress and milestones in their journey fighting the virus. And I think that there's been a lot of sharing. I think the calls that have happened by CMS, but also we facilitated calls among hospitals who are sharing their learnings and lessons. Even in the Bronx, for example, St. Barnabas, serving a very vulnerable population, has taken a number of steps around their systems flow to just make sure that they have high reliability, including organizing teams in particular ways, having a regular review of the data to try to provide insights into how they might change their workflow or clinical evaluation processes. And it's also places that are starting to stratify their data by race and ethnicity, so they know how it's impacting different populations. And then there's the ways that folks are engaging with their private sector partners, employers in their communities, and using the tents. But it's just so disheartening to see the impact on Elmhurst Hospital and in New York and some of the places there. But I think people are seeing things that they've never seen before as they're caring for patients. And so it's going to take a collective group of us to be sharing with each other. And I think that that's an important role to play around kind of these peer-to-peer learnings and then making changes based on that.
Yep. And where do you think that digital health has really stepped up to the plate, both in the hospitals, treating patients, and treating patients outside of the hospitals as well?
Yeah, I think we're seeing such an explosion of telehealth to try to reduce burden on the system, but also to help, again, support the stay-at-home approach, and having people have a place that they can go to get direction on and guidance on what steps they might take next. But it's also a way for clinicians to help other clinicians and care teams to help each other, so that the hospitals aren't burdened. And those are folks that could play a role. For example, I see patients now via telehealth as well, and it's helpful to provide reassurance or provide guidance on whether they need to go get care in a hospital or other setting. And I think that's where digital health is really going to be important, because they're, in this virus, people may not have significant symptoms, or if they have some symptoms in their home, it's still important to monitor both their heart rate, their oxygen saturation, how they're doing from a vital standpoint. And that can relieve precious use of resources and PPE in hospitals. So you have the right people going there. So we've been seeing folks use oxygen saturation monitors that, through are wirelessly connected to their care teams virtually. Also diabetes, we're seeing some of that virtual health be used well. So all the digital health that people have been developing is coming out to play and really be useful in this pandemic. And I think that virtual and digital health will continue to grow as ways that we might see healthcare delivery different in the country, and when more support, I think, and uses for it.
Great. And this is a question we didn't go over before, but when you're seeing patients via telehealth, is there specific symptoms that you're listening for that are a red flag where you would direct them to go seek care inside of a hospital?
Yeah, so we're seeing on average, that symptoms appear on day 5 of post-exposure. And so, but they could happen earlier, they can happen a little later. The ones that I look for are and GI, so some upset stomach, diarrhea, lack of appetite. Those are atypical, but you certainly see them. And then others, difficulty breathing, even chest discomfort, because this virus impacts the heart as well as the lungs. We always think about this virus as one that's impacting respiratory function, and it does, but it also impacts in the heart. We're seeing people have experiences of heart disease or heart attacks as a result of this. The other is just a sense of achiness, and coughing is another big symptom, but that's consistent, again, because of the impact that it causes sometimes a pneumonia as well. So those are the main ones, but I would just say, because we don't know a lot about this, anything that seems odd or out of the ordinary prompts kind of further questioning. And then what helps are the labs that can get drawn, if they get drawn. And then if you're at home, I just watch the vital signs. Those are the important: fever, your heart rate, your oxygenation. And if there's, changes on that are significant, from normal, then those prompt consideration for next steps and potentially taking more aggressive action.
Yeah, that's really helpful to know. And so moving past this pandemic, when we finally do see the other side of this, what do you think the biggest lessons learned will be, where we'll look back and think, A, B, and C are really where we need to focus our improvements for the next time that this happens?
I think that one is going to be that we've got a ways to go before we are there. But in the midst of this, there are going to be opportunities and moments to catalog and understand what we might do. One is we've got to reinvest in public health infrastructure and in pandemic preparedness. Several years ago, the office that monitored and designed strategies for pandemics was dismantled by the administration. And so we need to bring that back in a form that makes the most sense. Two, I think we've seen red tape and actions being taken around healthcare delivery, both virtual reporting, flexibility and care design, where I know that Alina in Minneapolis, for example, had a 3-year plan to go to value-based care and redesign their primary care infrastructure, and they were able to do it in a month because of the flexibilities and opportunities provided by the government, and because, frankly, they just had to. And so those kinds of accelerations is that we're not turning back the clock. There are things that we have to say make sense, and we can't turn back the clock on them. And so the use of reimbursement for phone being the same as telehealth, even some things. So I think about it as in systems, structures, and reimbursement, and then facilitating cross-stakeholder engagement and alignment. I think we've seen a lot of that. That's been helpful. And I think if we move towards helping people achieve health and not just healthcare and not just sick care, then I think we need that kind of cohesive quilt of partners coming together, and policies, regulations, and systems supporting that. So I think we'll also learn about how we are able to move testing and treatment forward quicker and sooner, and not just on viruses, but on other conditions as well. And then I think we've gotten a better understanding of workforce needs and how we might redeploy and engage workforce in different capacities, and what teams might look like. So I think you're going to see really interesting conversations about what teams of the future might be, and what kind of skill sets and they should have, and how they're organized, and how you might respond to emergencies. So I think that there's significant investment also made by the government in public health preparedness that's going to the hospitals. But I think the hospitals need significantly more resources. What came out recently on the $100 billion was largely a rescue plan. What needs to be moving forward is a Marshall Plan, is really one that's around recovery and positioning for a healthcare system we can all be proud of, and is delivering on health as we hope.
That's a great place to end it. There's a ton of lessons learned from this. Really appreciate you taking the time. This has been really informative. And thank you. Thank you again. Stay safe.
Thanks, Jody. Appreciate you and health for the opportunity and for all the great work you all are doing, and hope you'll all stay safe. And again, reiterate, it's important to stay home and stay safe.
That's right. Thank you.
All right. Thanks so much.
Thanks for watching this interview. We're doing our best to keep our health community up to date and informed as the pandemic progresses. So please check back for more interviews and blog pieces with leading health experts, as well as check out our Health COVID resource page for more information. Thanks again.